Hello, my name is Taylor, and I am going to be inserting a nasogastric tube into a patient today. And the first thing I'm going to do is check the order, make sure I have the correct size and the correct patient. And I'm going to get my supplies ready, and I'm going to come in and introduce myself to the patient. Hello, my name is Taylor. I'm going to be your nurse today, and we're going to be inserting a nasogastric tube into you. It's going to help decompress your stomach, so it's going to help stop your vomiting and nausea that you've been having. It's going to help you feel a lot better. The process is painful, but we will get it done quickly and efficiently and get you feeling better. Can I get your name and date of birth? Mildred Campbell, and her date of birth is 8/3/50. Do you have any allergies to anything that you know of? She doesn't. Are you having any nasal congestion or runny nose today? She says no. Have you ever had any injury to your nose that you know of? She says no. I'm going to have her get my pen light out, so I didn't bring with me, and check her nose to make sure there's no deviated septum or any other kind of injury. Check the mouth to make sure everything looks clear in there, and then I'm going to check the patency of each nair. So can you blow out for me and blow out again? And they both seem like they're good and clear, so I'm going to use this right one. I'm going to raise the head of raise the bed, and I'm going to have her sit up some, and she's in a pretty good position right now. So the first thing I'm going to do is put this. I'm going to perform a full abdominal assessment to make sure that she is having bowel sounds. So I'm going to put this over her to keep her dry, and I'll give her an emesis bucket in case she feels the need to vomit during the procedure. And Mrs. Campbell, I'm going to talk you through this. So what we're going to do is I'm going to stick a tube, and it's going to go through this nose over here, and it's going to go down, and once it hits the back of your throat, I want you to put your head down just like this, and I'm going to have you take a whole lot of drinks and just keep drinking and drinking. It's going to help me push that tube down and make sure we get it into your stomach. I'm going to get my put gloves on. I'm going to wash my hands and put gloves on.
Yeah. Was that everything? I think so. It's hard to remember. I know. I said all of this. I did the air bolus. I did verify.
I'm going to get my tube out. I'm going to put this anti-reflux valve on the end of the tube.
I did the anti-reflux valve. I said.
I coil the tube around my fingers just to kind of help unstiffen the tube so it goes down a little easier.
After everything else,
I'm going to clean the bridge of Miss Campbell's nose so that the tape sticks a little easier. And I'm going to measure the tube. So I'm going to go from her nose to her earlobe to her xiphoid process. And she's at about 50.5, so I'm going to put a piece of tape there to mark it. And I'm going to put some lubricant on the end of the tube. Okay. All right, Miss Campbell. We're going to get this going. You're going to feel some burning sensation, but we're going to go as fast as we can. It's hit the back of her throat, so I'm going to have her bend forward. And have her take lots of drinks, Drink, drink, drink.
I would document where it went to,
and if it's meeting resistance, you can kind of twist the tube to help it keep going. And now I've got it in to my tape. So I'm going to, before I tape it, check to make sure it's not coiled in her throat. And then we'll get the tape on. I'm going to apply some benzoin to kind of help the tape stick a little bit better.
This today, I will take the tape off, and I instruct them if they need to hold their breath.
if Miss Campbell was to vomit or cough while I was doing this, I would stop inserting it, allow her to vomit or cough, pull back just a little bit until she's finished, make sure that the airway is clear before I continue again. Okay, so I've applied my tape. And I'm going to draw back some aspirate. And then I'm going to test that with a pH strip to ensure that we're in the stomach, and I'm looking for anything that is less than 5.5. I'm also going to send Miss Campbell to X-ray, and I will, before she goes, clip this to her gown. Put that like that, and put this in her pocket. Send her to X-ray. When she comes back, we're going to hook it up to suction, which I already have set up for her. So I would unclip this and put on the suction, and it's going to be on low intermittent most likely. Another way that you can check to see if the tube is in the stomach is to put a bolus of air and listen to the stomach to see if you hear gurgling. It just kind of depends on your company policy to what they want to do. Now everything is hooked up and my patient is good. I'm going to document any gastric contact that comes out, and I'm going to document how the procedure went, what size lumen I went in with the tube, and how the patient tolerated it. So now we're going to be taking it out. So I'm going to wash my hands and put on clean gloves. I'm going to unhook this from suction and go ahead and clamp this. Okay, and I'm going to ensure that I have the same patient again because I would have left and come back in. So we're going to untape this and I would also perform another abdominal assessment to make sure we're having bowel sounds.
So now we're going to go ahead and do removal. I'll wash my hands, put on gloves.
Going to untape. Okay, Miss Campbell, we're going to take this tube out. It's going to go a lot smoother than when putting it in. Oh, I need to unclamp this. Then when we put it in, it's going to go faster. It's not going to hurt quite as bad, and it'll be very fast. So I'm just going to pull it straight out. Are you ready? I'm going to have you breathe. Take a deep breath and hold it. 1, 2, 3. And I would check the tubing to make sure that there's nothing that's broken off, to see any residual. One thing I could have done, if there was aspirate in the tubing, I could have pushed a bolus of air just to get the aspirate out, to kind of make this a less messy process. So then I would document all of how the procedure went, if there was any residual left, and make sure that my patient is comfortable. I can clean her nares for her, give her some oral care, and put her bed back into a low position and put the bed rail back up.
I'll give them the tissue again.